Hi, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at PetAbility Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of PetAbility. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them PetAbility sent you.
We measure pain, and we do it, as you said, in a way that is very unique.
Welcome to PetAbility. I'm your host, Kathy Simon, certified veterinary technician and certified canine rehabilitation practitioner.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Good afternoon, Kathy. How are you?
Good afternoon, Chris. I'm doing all right.
Yes. I just got back from a trip, so I am happy to be home and focusing once again on PetAbility Podcast.
I'm glad you're home too, Chris. I wanted to call you like every day.
Well, I was going to say, oh, Kathy, did you miss me?
All right. Well, don't get crazy.
I thought you might enjoy the reprieve from actually me hounding you every day. So what are we talking about, Kathy?
Oh my gosh, Chris, we have so much cool stuff to talk about today. As you know, and the audience probably knows, I've been working on getting my certification in hospice and palliative care for pets. And so now I'm about 3/4 of the way through the program. It's been very intense work, lots of classwork, lots of paper writing, lots of exams, but I'm really enjoying it overall because I think that this is where I'm going to make my greatest impact as a canine rehab practitioner. But the interesting thing was that during the coursework, the company PainTrace was brought up to the class. And I was very intrigued, Chris, so I brought it up to you. And we had an opportunity to talk with Katie Hickey from PainTrace. So we're going to be interviewing her today about this product. Essentially, we're going to try and use this product to measure either chronic or acute pain in animals. And it makes me, the first thing I thought of is, as a technician, I've been a technician for 35 years, and I will tell you that I believe that the number one concern from clients about their pet is, are they in pain? Is their pain being managed? I would say it's a number one concern.
And where is their pain? Like, yeah, they know they're uncomfortable, they're painful, but what is the source? I think that's, right. Because they can't talk to us, right? So, and oftentimes animals are very stoic and, it's just hard to identify, where that pain is coming from and how severe it is.
And even as a rehabilitation practitioner, sometimes it's difficult to say exactly where the pain is coming from. And then if there's pain, is it the source of the pain, or is it referred pain, or compensatory pain? Exactly. Yeah. I was thinking a lot about the definition of pain after we met with Katie, because, pain is identified, or pain is described as a complex sensory and emotional experience, typically associated with tissue damage or potential tissue damage. So it's not only a physical experience for our pets and for us, it's also an emotional experience. And as you know, I'm always interested in the emotional lives of animals. And so I started thinking about pain in our pets and how that actually can sort of erode at that human-animal bond. So they're experiencing a level of discomfort they're experiencing a level of emotional discomfort, and they may isolate themselves. They may be grouchy. They may not want to go for their walks. Maybe that was the thing that they did with their owner. They would go for a walk every day, and maybe they don't now. So I think that there's a lot of layers here to pain, both physical and emotional.
Agreed. And you summed that up very well, Kathy. I just know, after we spoke with Katie Hickey approximately a month ago, we shortly thereafter, we commiserated and we're like, that was awesome. And we wanted to highlight that this technology is on the market for pets. So we asked Katie to be on the show because we were both so impressed with the promise of this technology to quantify pain. But before we launch into this wonderful discussion, I'd like to tell you a little bit more about Katie's professional background. Katie is the clinical program director at PainTrace, the parent company of PainTrace. Katie completed her Bachelor of Science in Animal Science and her Master of Science in Reproductive Physiology at the University of Guelph, Canada. She has worked in academic research as well as an operations director, researcher, and continuous improvement director in the animal production industry at Cemex. At PainTrace, Katie brings animal health and clinical experience through her work in academics and industrial innovation, research and development, product development, and global team management. Working with PainTrace in industry for 3 years, Katie understands the products in real-world use and can apply best practices with clinical research clients that use PainTrace as a clinical research outcome measure. Welcome to the show, Katie Hickey.
Welcome, Katie.
Thank you, ladies, very much. Thank you for having me and for giving us this time to really share and talk about PainTrace. Everybody that we talked to is in a state of disbelief at the beginning of the call in terms of, well, there hasn't been a way to measure pain quantitatively before, so how can you? And it's wonderful to be able to have a venue like this to share with people and bring it to the spotlight.
I agree. I was very incredulous going into our call, Katie, and you did such a good job presenting the data and telling the story that, again, just excited about the revolution, right? The potential revolution that may occur here very soon. So
I don't think there's anything else on the market like it. I'm really intrigued to hear more about it. So why don't you tell us, Katie, what is PainTrace?
Absolutely. So PainTrace it's actually very simple, which is again a part of the incredulous part, but we do exactly that. We measure pain. And we do it, as you said, in a way that is very unique compared to anybody else that is attempting to do this on the market. We're not looking at heart rate variability or other vitals. We're actually measuring on the skin surface. So we use skin-based sensors, and we're measuring the signal that goes to and from the part of the brain that processes pain. We've been able to hone in on that signal. And what we're measuring is the balance of that signal. So the signal from the body that goes up to the brain that says, hey, there's something going on here. And then the brain processes that and sends a signal back to the body to say, okay, here's what I want you to do about it. So we measure the balance of that signal.
Katie, you said, that you're putting sensors on the skin. Again, that seems odd to me that you could, measure the signal. I know when we spoke, you called it a biosignal. You said that that's proprietary information. But can you extrapolate a little bit more on that, like how this works?
Yeah, there's a reasonable amount of fMRI data, the functional magnetic resonance data out there now, where they can look at what's happening in the brain. So there's a few papers out there now that are showing that you can actually measure some of that core brain activity on the skin surface, and so that's exactly what we've been doing. It's been a long time in the making. The early research started with the company well over 10 years ago now, and we've gone through different iterations of the product itself and fine tuning and streamlining to get to the point where we're at now. Like I said, it's that simple. So we do pick up a systemic signal. So we pick up on all parts of the body. And we're able to measure both chronic and acute pain, and we're able to actually distinguish those two. So PainTrace is a live signal. So you're watching what's going on with the pain levels as the trace is running, and simply where the value falls kind of on the pain scale gives you an indication of chronic pain state. So kind of the homeostasis of where the pain state is for for that particular animal. And you're able to see that within a matter of a couple of, 30 seconds to a minute of the trace happening. And the signal is very individual. So your pain signal is your pain signal. The system does work in humans as well. So Kathy, your pain signal would be, a little bit different than Chris's pain signal and would be a little bit different than mine. But the general ranges follow through, and you're really able to see in a really quick moment where that chronic pain level is at.
For example, if I have a patient in the office that maybe has a bicipital tendonitis and I haven't hooked up to PainTrace, I may very well see that signal change when I press on the biceps tendon.
Yeah, and that's where we see the acute pain. So as our signal's running, it's running along a graph. So imagine it's not an ECG, but imagine an ECG type signal kind of plucking along as you're measuring it. So where that falls on the graph is an indication of chronic pain. And then if you introduce a stimula during the trace that causes a change in the pain state, so it causes an acute pain. So like you described, maybe palpating a tendon, or maybe manipulation of a joint, a flexion or an extension of a joint, maybe a visceral palpation of the abdomen or something along those lines, and you cause a change in that balance of that signaling going to and from the brain. What we see on the trace, or what you would see on the trace when you're running it, is a deflection from the baseline. So it looks like a peak, basically. So a change from the baseline. And the size of that peak, it goes even a little farther in that the size of that peak is directly correlated to the magnitude of the pain. So the bigger the peak, the bigger the pain experience. And we know that from some of our really early work in correlation with human self-report. We've done some chronic and some acute pain studies early on in the early validation with humans, so that we know those correlations are the way that they are.
Katie, can you describe that a little bit more, the human self-report, and just to clarify for people, because that terminology is probably not familiar with a lot of folks.
Yeah, so the early studies that we did with human self-report, and so human self-report is kind of the gold standard for pain measurement. But like I described, with the pain levels being unique and individual to you, so is your perception of pain, and so is your report. So you did a beautiful job at the beginning of describing the complexity of pain. Pain is not only physical, but we call it biopsychosocial. So there's a biological component, there's a psychological component, there's a social component. When you fell down as a child, did your parent pick you up and dust you off and say you're fine and send you off and running again? Or did they, kind of jump all over you and, gush and, oh my goodness, are you okay? And, all of that plays a factor in how we perceive pain through our lives. And it's all part of that split-second brain processing that happens, which is incredibly complex. So the problem with human self-report and with some of the behavior scores that we use in terms of animals is that there's definitely a degree of interpretation there. So if you were reporting, either of you were reporting to a doctor, what is your pain level on a scale of 1 to 10, 1 being no pain, 10 being the worst pain you can possibly imagine, you're going to report and you're going to interpret that very, very differently, because that experience is unique to you. So while we correlate with self-report, what PainTrace does is it really gives us that objective measure, that quantitative numeric measure, to help everybody get on the same page. Is there pain or isn't there pain? And then, as you described before, going into, okay, where is that pain? What is it coming from? Is it when I flex and extend that joint? Or is it really when I palpate a little bit deeper and get into that tendon, and maybe that's what's going on?
You mentioned that, your pain is your pain. So what you were saying before is that there's no standard baseline. You connect the PainTrace system to the body, and you establish what that being's baseline is, because we all have a certain degree of maybe discomfort or pain or what have you. So that's the baseline. Then a stimulus may be applied that changes from that baseline.
Correct. And so while the baseline is unique, we do have a good understanding of some of the trends in the baseline. So we know what chronic pain looks like, and we know what, healthy nothing going on looks like. So What happens with PainTrace is when the signal coming from the brain is amplified or is stronger, it depresses the signal for the PainTrace. So the more negative the signal with PainTrace, the more pain is present. So just to put it into perspective in terms of human terms, because it's easy to relate to, a normal healthy child would probably come in with a trace value, a baseline value of about +6 to +12. A normal healthy adult active with no pain happening would probably fall at about a +4 to a +6 or a little bit higher level. As we start to get a little bit more achy or a little bit older, we're probably falling about a -2 to a 2 range. If we're talking polyarthritis, we're getting into those -5s, kind of -10s. And then something that is post-trauma, you could be as low as, -20s to -50s. So the signal is unique and it definitely reflects the individual, but there's definitely ranges that give us information right off the bat. With the chronic pain signal, we equate it a lot to being like stepping on a bathroom scale. So your signal is stable over time. So we can actually measure those chronic pain baselines over, you can measure it within a trace, absolutely, but we can also measure it over days, weeks, months, years. We've measured individuals out that far. And unless there's a major change because of an intervention or a major change in your pain state, your individual baseline is pretty stable over time, much like a scale is. You get a little bit of variation from time to time, but it stays fairly stable within an individual.
So again, it's counterintuitive because you're talking about the numbers on the scale going down, but that's indicative of more pain. When you were talking about Kathy and me, and that we each have this, that our own perception, I guess, the human self-report, Kathy has a baseline, I have a baseline, and then the same stimulus is applied, but how it's measured on the biotrace could be vastly different based on the factors that you mentioned before, the biopsychosocial. So then I got me thinking about cultures too, and how across cultures, pain is very different and reactions to pain. As a physical therapist, I saw that, amongst humans and things. Think about the people that, can, I don't know, lie on a bed of nails. I couldn't do that. But, somehow they've been trained to do that and their perception is different. So I just thought that was a neat example, perhaps, to get people to understand.
That's the thing with PainTrace. It is reflective of your pain experience.
What is monitoring these pets look like? Is it something they have to wear? Is it something they have to wear for a long period of time? Is it tolerated well?
Yeah, so it's really easy to hook up. The PainTrace system uses 2 sensors. They're a disposable adhesive sensor. They look kind of like an ECG sensor. So if you've ever gone and gotten a heart monitor done, or you've seen that done, they look much like that. So they do need direct contact with the skin. So a little bit of a shave spot, a little bit of a clean, just to make sure that those sensors are good, have really good contact with the skin. And then they're connected to a set of cables, and the cables are attached to a little device that's about the size of a deck of cards. And that's what takes in the information and reads the algorithm. And then it reads live to an iPad, to our software system on the iPad. And that's how you can watch the live trace happening. So it can look like a lot of different things. The sky's really the limit when it comes to PainTrace. The system works in fully active, awake patients. So in that case, what we do is we put that little device that's the size of a deck of cards in a neck collar or in a harness so that they can be up and moving around. You can trace animals while they're doing whatever it is that they do day to day. They could be going up and down stairs. They could be playing in the backyard. You could be going through a head to tail orthopedic exam. Whatever it is that may be happening. You can even trace during a procedure. So you could trace during chiropractic assessment or a laser treatment or anything like that. So traces can be essentially as short or as long as you like. You can get that chronic pain state, like I said, within 30 seconds to a minute, and then leave the system on for whatever it is you'd like to do. So if it's during a veterinary visit, it can be during the entire physical exam. If you're doing a rehab assessment, can be during some of the movement analyses and that type of thing. We have left the systems on for as long as 48 hours. The batteries in the system last for about 3 days. They're typically well tolerated. There's one small caveat to that. So we do work in about 8 mammals right now. So dogs and cats are the most common right now. We do work in horses, in cattle, in pigs as well. And then we've done some work in smaller animals. So rabbits, guinea pigs, chinchillas as well. And of course, humans. And the one caveat we found to wear is we just have to watch the rabbits. We have to watch the bunnies really closely because they do like to nip at those cables. And so that aside, they're usually really well tolerated. You know, we've got systems to tuck the cables up out of the way so that they're not annoying to the animals when they're moving around and that type of thing. So as long as they leave the sensors on, we have followed post-surgery out 48 hours. So I mentioned that the system works in fully awake and moving around patients, but it also works in sedated and anesthetized patients as well. So there's the ability to hook up the system before surgery, follow through the entirety of the surgery, and watch recovery, so that those anesthetic protocols and those pain management protocols throughout recovery can really be individualized to the animal, to the pet, right? Are the drugs that we're using effective for that animal? How long are they lasting in that species? And that type of thing. So to really make sure that those protocols are individualized and effective.
I'm going to play devil's advocate a little bit here, Katie, and ask you, is there a possibility of getting a false reading or a false positive? Are there any factors that could lead to having faulty information?
Let me start by explaining when you bring PainTrace into a veterinary clinic, our team works really closely with the staff and with the team to help work at interpreting some of the things that may become caveats, essentially. And so not false information, but interpretation of what might be happening. So the example I'll give you is medication. Because we're measuring the signal that goes to and from the part of the brain that processes pain, when we're using a medication that acts on a specific area of the brain and interrupts that signal, because that's what it's supposed to do, that can look a little bit different on our traces. So as an example, if we see a trace with a pet that is on something like a gabapentin or monoclonal anti-NGF antibody, what we see is medication works is it blocks the receptors of the pain receptors and impacts the descending pain pathway. So it impacts the signal from the brain back down to the body. And so what we see normally are acute peaks, like I described before, more negative is more painful. We normally see those peaks they're negative peaks. They point downwards, like in a cave, like something dripping down out of the top of a cave. So what we see when that descending pain pathway is blocked, the ascending pathway coming from the body is still happening. And so what we see is that those acute peaks, they flip upside down because you still get the signal going up, but we don't get the signal coming down. And so there's little things like that that our team will help interpret in terms of what may be going on. And the team loves things like that. When there's unique cases that they can really help with and dive into, they like the challenge and the little bit of something different in the interaction with the clinics. And so that's one of the things that I think is unique about our company and the way that we interact with people.
When I think about it, I think this isn't something that's used for diagnostics, but it does need to be interpreted so that we can address those patients' pain. I think, the interpretation piece is key.
Most cases are straightforward and simple, and it's really easy to interpret in what's going on. But as I said, those unique ones we're always there to help with. So it's usually explainable in terms of impacts of a medication, or it's usually explainable.
Who's using PainTrace? It makes a lot of sense to me that people like Chris and I would use PainTrace because we're canine rehab practitioners and we want to identify pain so that we can treat it. But who else is using it? Are they using it in other specialties, surgery, ophthalmology, neurology?
Yes, most definitely. And as I said before, the sky's the limit a little bit here, but the most common practices that we're seeing it in, you described rehab, absolutely. So not only where is the pain, or is there pain and where is it, but are the treatment regimes that we're using, are they effective for that individual? So like I mentioned, you can track over time, how effective are the medications, are is the physio, are the different things that we're doing. You can track over time, are they working? Are they causing a reduction in pain? During surgery, like I mentioned, really common during dentistries, especially, and some of those stoic cats that maybe don't show a lot of a pain response, but in any general surgery as well. We also find in behavior, there's a really big uptake in behavior, trying to determine, is the behavior stemming as a result of pain, or is it actually a behavioral condition that needs to be managed, and really trying to streamline or speed up the treatment to figure out where do we need to treat. So in some of those cases, what we're seeing is animals that are a little bit too challenging to be able to understand that when they're awake, seeing a sedation of those animals, going through an examination and being able to see the pain response while the animal's sedated to determine, do I need to treat pain or do I need to treat the behavior? We also see, Kathy, you mentioned at the beginning how you heard about us in the first place in terms of hospice palliative care and that type of thing. We have veterinarians that are following, actually even taking that back and following all the way through. So starting regular baselines for PainTrace during wellness visits in young animals and following all the way through to the geriatric years. So they can pick up really quickly on any changes in the pain state, and sometimes before you can see clinical signs of that pain manifesting. So being really proactive at catching things early.
When you're talking about, the wellness visits and kind of monitoring over time, an example, I think, of where you don't know that the pain is necessarily occurring because there are no clinical signs is arthritis. Because I know for myself, I wake up stiff and sore every day, but to see me, I play pickleball 4 times a week. People are like, how do you get up and down from the floor like that? All that type of feedback. And I think our animals are very much the same, and they can't say, but I'm hurting. So, doing interventions and catching, because I think that osteoarthritis as a condition is the most vast, amongst all of our pets as they age. And so I definitely think catching that early and addressing it would be most efficacious.
And the other thing I like about it is that sharing or showing clients these measurable outcomes, I think is really good for the client. Look, our plan is working. The laser therapy that we're doing is working. These peaks are not, dipping down. And so we have something that we can show them that our plan is working.
Right. Because a lot of times you have to just go on blind faith,
Right.
Trust me, we know this is working. And Katie, I think one of the things that helped drive it home for me when we talked last time was just the introduction of a medication and then removing that medication, so again, that's a very clear variable, right? You hypothesize, let's take the example of degenerative joint disease or osteoarthritis, and you add a non-steroidal anti-inflammatory drug like carprofen or meloxicam, and you can then monitor and see how that chronic pain state is changing. And maybe they're on the medication for 3 months and you think, wow, they're doing quite well. I think we can discontinue or taper. And you monitor again via the PainTrace and you see that pain level is increasing again. Is that accurate?
Yes, absolutely. And I think just as important with that, we know, again, putting it into context with people, Tylenol works for some people, Advil works for some people, aspirin works for some people. And so, as important as it is to know, is the medication or is the treatment that we're using effective, it's also just as important to know, is it not? So that then you can very quickly get that feedback and pivot to something that might be more appropriate for that animal. And what that helps is with the relationships between the veterinarian and the pet owners is, really solidifying those relationships so that everybody's on the same page and you can see it and you're working really quickly to what's best for the animal.
I love that you said that about, pivoting, because I remember when we were taking our coursework in the small animal rehabilitation program, and, they were saying at that time, I don't know, maybe there were 20 fairly common different anti-inflammatory drugs. And they were cautioning people, vets, because I can't prescribe medications as a physical therapist, but the veterinarians in the room that, you may be used to giving, Rimadyl, and just expecting it to work. But they're like, if it's not changed, you have other choices and that may work better. And this is a tool that can help you to identify that. You mentioned before that you're using this in like 8 different mammal species, but you mentioned some farm animals like pigs and cattle and horses. And I'm sure some of our listeners, because I'm assuming a lot of them are more like you said, pocket pets and the dogs and the cats, right? So can you give an example of how this is used in, maybe the large animal industry and world?
Absolutely. You're touching on something that's near and dear to my heart because that's actually how I came to work with PainTrace. My background is actually in large animal and it's actually in reproduction. And so I was working with a company that had breeding bulls. And so we also use the systems for research, and we actually brought the systems in that environment for a research study that we were doing that was for a supplement to check on, does the supplement improve the mobility or the pain states in the bulls? And as hard as it is to read feline, behavior scoring and that type of thing, it's really, really hard in some of the large animals, the cattle and pigs as well. And so we wanted something that was objective. So we brought it in and ended up using the system for a whole myriad of things. So not only for the research study that we were doing to show was the supplement effective or not, but what's going on with those animals. So is, again, like the small animals, is medication effective? Is that medication effective for that individual? What type of a pain do they have? If there's something going on with joints and it's affecting their mobility, is it something like an arthritis where once they get up and moving and they're playing their version of pickleball, does that loosen them up a little bit? And is that better for them? So we would put them on an exercise regime so that they would get loosened up before we would ask them to work. Or is it something more along the lines of they're recovering from an injury and extra movement actually makes them more painful, and so then we know to limit that activity and help them heal a little bit more, and we can really monitor that progress and understand when are they ready to work again, when are they ready to, following a surgery. This one's particularly true in equine with horses. Following a surgery, when are they able to be walking more regularly? When are they able to be turned out into a paddock? When are they able to ride or do or race or do whatever it is that they might be doing? The other application in terms of large animal is, again, a little bit leaning towards the research side, but not entirely, is helping us understand our welfare protocols and practices. We have maybe 2 different ways of housing or 2 different ways of monitoring these animals in their day-to-day practice. Which one's better? So we can run studies and evaluate which practice is better for pain state and general wellness of the animals to help drive those practices.
I also want to go back to you mentioned that, you have to hide the cables from the bunnies and things like that. And you said generally it's tolerated well, but when it's applied, it is simply getting feedback from our bodies. There's no stimulus. I guess when I hear like an electrode, I think a lot of times people think that they might feel some electricity or some shock or what have you, but it's not painful or noxious during the monitoring process at all, is it?
Not at all. No, it's in our regulatory clearance. So we are a medical device, and it's classed as a non-invasive medical device. So there is no electricity, no current, no anything being introduced into the body. We're simply measuring on the skin surface what's there.
And then you mentioned medical clearance. I also wanted to say that it is FDA approved for both usage and research in animals. And you're currently working on the human side. And so far it's approved for research with people.
Correct. Yeah, we're approved as a secondary outcome measure because we're a non-invasive medical device. We're approved as a secondary measure in research studies for both animals and in humans. And then, yes, as you said, with the use of a veterinarian in practice that way.
Can you tell us, Katie, what the cost is for the veterinarian and maybe even what the cost might be for the client?
Yeah, I can give you some averages definitely in terms of ballpark. The way PainTrace works for veterinarian is we work on a license agreement. And so what that gets the veterinary practice is all of the hardware that you need to run the PainTrace. So the device, the cables, the iPad, access to the software on the iPad so you can watch the traces live as they're happening, also access to the software from the cloud. So all of our data goes to secure cloud and it's encrypted, but you're able to watch the trace almost live from a remote location. So if you had, a vet tech or a vet assistant or somebody running a trace, you can watch what's happening within about a 3 to a 5 second delay remotely as well. So you get those pieces. And then, as I mentioned, our support, which is ongoing, and training. And the training is not only for, the logistical, how do you hook up PainTrace, how do you run the software and that type of thing, but we'll also run training sessions with, if you like, with your front office staff so that they know how to talk to people about PainTrace and how to describe it and how to schedule it. We'll work with the staff in the clinic to figure out how to integrate PainTrace into workflows. So, okay, maybe we start with bringing it in for surgeries, and then, really start to branch out and integrate it into the general wellness visits and the rehab bundles and how to evolve through that process.
Well, one of the things that I was really impressed with is that you have the voice recognition software. So as you are doing whatever, the exam, the manipulation, the palpation, the surgery, you can timestamp what is happening onto the trace and then be able to make correlations.
Yes. So you were able to then go back. So you can stamp those traces in one of two ways. As the trace is running on the iPad, you're able to tap on it and type in what's happening. Maybe it's a movement. Maybe the dog has stood up or is walking. Maybe you're manipulating a joint or that type of thing. So you can tap on the trace and you can type it in, but everybody's busy and has a lot of things going on. So like you said, we do have a speech to text as well, where you can turn on the microphone and it will timestamp for you. You can speak the different things that are happening. And what that lets you do is then go back and measure what are those acute peaks? How big are those acute peaks? Because like I said, they correlate with the magnitude of the pain. And how do they change over time? So if you were doing an orthopedic exam or you were doing a manipulation of something today, you can in 2 weeks, in 2 months, in a year, you can do those same movements and you can measure the change in the response to the acute peaks and see, are they bigger, are they smaller? So definitely you can look at the change in chronic pain over time, but also the acute peaks, and the annotations let you do that, so that you can say, yes, this peak was directly related to what I was doing at that time.
And anything that helps to avoid typing for me is a win. So I love that you can make that voice notation. Katie, I know you had told us in the past that the PainTrace, this tool, assesses inflammatory and visceral pain. So anything with an itis on it is inflammatory, right? So we talked about arthritis previously. Can you give an example of visceral pain?
So yeah, I'll actually equate it to our most stark example is probably endometriosis in humans. Have some incredible traces with exactly that, the response during an episode of endometriosis or an episode of cramping and endometriosis, and the severity of the pain. We talked about that pain scale. Normally our acute peaks are ranging in that 1 to 10 range, but they can get quite severe. And some of the endometrial peaks that we've been able to measure, the peaks in response to cramping, have been of the magnitude of 27. So really severe.
And so as I understand it, visceral has more to do with like our innards, right? Like the organs and things like that may be a culprit and causing some pain. Katie, back to the cost. I know that you have a schedule, also as part of your support.
Yeah, so typically on average, depending on where they are in clientele, vets are charging between $50 and $100 per trace to customers. And some are offering it as a separate service and including it as a separate line item and doing it that way. Others are saying, no, I want for my surgery bundles or for my rehab bundles, I want to make sure that we have this information and I want to make sure it's included. And they're still charging about the same, but they're kind of embedding it into those packages. So yes, if you're running 3 to 4 traces a week, you are covering the cost of the trace itself. Anything above and beyond that is return on investment in your practice. And so it can be a real revenue generator for the practice. $6,000 for 1 year, $9,600 for 2. And then custom packages, if there's multi-devices or that type of thing, there can be discounts associated with that. So we would develop a custom estimate for you.
I think this is really exciting and promising technology, Katie, and I'm really excited to see how we can incorporate it into practices, our surgery, rehab, wellnesses, and behavioral, which was really exciting to hear because I hadn't really thought of the possibility of using this for behavioral cases, but it's true. Pain might be causing certain behaviors. And as we discussed earlier, pain is complex, and anything that can help us to make our patients feel better or to make them recover faster or to bring them back to the state of normal or what brings them joy is what we're all about. We want to see these animals succeed. We want to see them get better, and we don't want our animals to be in pain, and nobody wants that. And it's certainly, I think, on the forefront of most clients' minds. And how can identify it? How can we manage it? How can we make it better?
I just would like to talk about some of the unique features that make PainTrace so great. So to reiterate, it's an objective measure of pain. It's wearable, convenient, fast, and simple to monitor. You get data in real time. It's completely non-invasive, non-painful, and can be used across multiple species. So there is just, like we said at the beginning, so much promise here, and I'm excited to see this company grow and see PainTrace in many more clinics.
Katie, is there any final thought, anything you'd like to leave our audience with before we wrap up?
I think Chris summed it up absolutely beautifully there. That is our goal. That's our ultimate goal, is to help identify pain, help make sure that we can be as effective as possible at alleviating it, and making sure that we're leaving the world a better place, both for humans and for animals. And that comes with on the stress side of the parent animal or human, but it also comes on the side of human wellness as well. And so that's our goal. That's what we're trying to do. And we would love to hear from anybody that wants to hear more.
Katie, how can our listeners find you?
Yeah, so our website is fairly simple. It's paintrace.com, all one word. So there's some information on there, but there's also links to our calendars to schedule a meeting, anything like that. That's probably a really quick and easy way. You can also reach out by direct email, either to me or to our info at email. So my email is Hickey, KHICKEY at paintrace.com, or we have an info at paintrace.com, and you can reach us there as well if there's specific questions.
And the website is just full of information. So I would encourage anybody who wants more information to go there.
Well, Katie, thank you very much. Thank you for being on the show. Thank you for making the world a better place and making animals feel more comfortable. So it was wonderful to speak with you.
Thank you, Katie.
Thank you so much for the time, ladies.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at PetAbility Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you, and tune in next time.